Hi, Doctor.
Mr. Coffey, thanks for coming along today.
Doctor,
you said you had a mole that caught your attention.
I did. I have this one on my finger. My mate spotted it at the beach, and I think he's being a worrywart, but he booked me in.
Okay, alright then. We'll take a look at it for sure.
So, Doctor, what are the symptoms of melanoma?
So, the dangerous thing about melanoma is there's actually very little symptoms to recognise.
Ooh.
The main recognisable ones are bleeding or scabbing of the moles.
Haven't noticed that.
Okay, so apart from this, you must carefully observe your moles, and we got to follow the A, B, C, D, E rules of melanoma.
What's that?
Alright, that is actually how we initially diagnose a melanoma. I'll look out for 5 signs that may cause any further investigation or looking into the mole. A means asymmetry, that the mole does not have even sides and it looks like yours is a bit uneven. B stands for border. This means the lesion is uneven or jagged, and it looks like yours is okay in that respect. And C stands for coloration. If the lesion is too toned or black, you better watch out. And it looks like yours is.
Oh dear, that's not good, is it?
It's more than 6 millimeters. This is a warning sign, so we're gonna have to check that out. Yours is pretty big. And E means evolution. Has your mole changed lately?
It actually has a bit over the last couple of months. It's gotten a bit darker and bigger.
Alright.
Is there something wrong?
Okay. Well, we should be very vigilant.
Okay.
The preliminary test tells me very little, but there are a couple of worrying signs
That's not good.
about your mole. So what I'd like to do is properly diagnose you, and the way we do this is called an excision biopsy.
Okay.
This is where I'll cut out the mole and I'll send it to a pathologist, and he'll do it under further testing in a microscope.
That'll hurt, won't it?
No, we'll put some local anaesthetic on the mole. You just won't feel a thing. That's all I need from you today. I'll call you back in when your results come back.
Thanks, Doctor.
No problem. Looks like a melanoma.
3 weeks later.
Oh, Ben. Hi, how you doing?
Hi, Doctor.
Now, look, so Ben, the pathology reports have come back, and we've determined you've got stage 2A T3A superficial spreading melanoma. So what happened in the pathology test was Professor Milner viewed your mole under the microscope.
Yes.
This revealed that the mole, or the tumour, was 3 millimeters deep,
Oh, that's not good.
with no ulceration, and it contains cancer cells, confirmed after a dye was passed through. So there is no need for any further testing. Luckily for you, the melanoma hasn't yet spread to your lymph nodal system or your bloodstream.
That's good.
Which would have decreased your survival rate by 20%.
Oh, wow.
So before this can happen, we're going to have to act quickly.
Right, this is happening too fast. How did this happen?
So after doing some research, your melanoma was not hereditary, and you haven't had any bacil or carcinoma cancers before.
Okay.
This means your melanoma is due to UV exposure. So what's happened is the melanocytes in your body that control melatonin, a chemical that would help you avoid skin damage by taking away the UV rays, has been overexposed to dangerous UVB rays.
Ooh.
This overexposure has caused the release of BRAF genes that create uncontrollable growth in skin cells. This has formed tumours. Yes, so we must take action now so these hijacked cells stop spreading.
Yes.
We've got a few choices.
Yeah.
The form of treatment I recommend is a wide local excision, a type of surgery that will take out the tumour affected area and the unaffected skin around it to assure there's no extra spread. This form of treatment is highly effective, but we most likely have to amputate your finger due to the margin of unaffected skin. Now, to save your finger, you could use a new form of treatment, immunotherapy drugs. I could put you on a PD-1 inhibitor drug that turns off the signals in the T cells to not attack any other bodily cells. When these signals are turned off, immune cells attack all bodily cells, including the cancerous tumour cells.
I'll take the risk and keep my finger. So, I've been taking my cancer drugs for 3 months now, and thanks to the pill, and my Dr. Van Lathum. I feel good, and guess what? I got the call yesterday that I'm free of melanoma.